A procedure involving deep brain stimulation is showing promise in helping treat a variety of neuromuscular conditions, including epilepsy, Parkinson's disease, and Tourette's syndrome. To learn more, we welcome Dr. Jonathan Parker from Mayo Clinic, Arizona. Good to have you here. Thanks for joining us. Deep brain stimulation. What are we talking about?
Well, this is a procedure that's been around for a while, but technological advances have made it much more safe and effective. Typically involves two thin wires placed into the brain and then a battery in the chest, which is rechargeable. And then working with the team, we do different parameters of stimulation to treat those different conditions that you just mentioned.
Yeah, and Parkinson's, tremors, dystonia, all of those things, you're seeing results here, aren't you?
That's correct. You know, in our state alone, there's 20,000 people with Parkinson's disease, and when it becomes advanced and it doesn't respond to medication, deep brain stimulation can be an option. Can be very safe and effective.
In researching this, I saw also maybe epilepsy, OCD, chronic pain. These could be possibilities?
Yeah, and it almost seems too good to be true, right? There's so many different conditions, but the key is this is really taking advantage of our expanding knowledge of the brain, so we understand for those individual conditions, where do we stimulate? And that's really helped guide that therapy and opened up many conditions we can treat with it.
We have a video here of the process of how it actually works, the surgery, all that kind of business. Walk us through here. What are we seeing here?
So what you see in this video here is an animation of that thin wire or lead that goes into the brain, and then that connection underneath the skin down the side of the neck, and then that battery in the chest. This is a specific version right here, a deep brain stimulator to treat epilepsy. Sometimes we stimulate the surface of the brain. Sometimes we have to stimulate a deeper location. And that's what that animation is showing you there.
Interesting. Interesting. Okay, so the electrodes are placed there in the brain. By the way, what were we looking at there?
So we saw just a brief window there of actually a guidance system that we have in the operating room. So it's sort of like a GPS system.
Oh, wow.
To precisely put that electrode in the right brain region. And we can also record from the brain. So we have the GPS and also that brain recording. Helps us dial things in just right.
So again, and the device is implanted in the chest, but because all of this is kind of under the surface, is it stay? I mean, could these things get pulled out at any time?
So they're very well secured. There's two little brackets, if you will, underneath the scalp that hold the leads in place. And then that battery's in the chest, and there's plenty of slack on that wire, so it can move very freely. So the risk of these getting pulled out is very, very low.
The procedure itself, how long is the surgery?
So the surgery itself takes about 3 to 4 hours. Typically, the patient's asleep, and generally they go home the next day.
Wow, so everything's done at the same time? There's no do this first, do this later?
Sometimes we do everything at the same time. Sometimes we have to stage it or do two separate surgeries. It just depends on the particular patient's needs.
And the stimulation, so the patient wakes up.
Yeah.
Is it already working, or do you turn it on while the patient experiences this?
Yeah. We typically wait a few weeks to a month to turn it on.
Oh, wow, okay.
We let the patient heal, we bring them back to the clinic, and then we turn on the device and we do all the adjustment then. For a disease like Parkinson's disease, we might see the effect right away, instantaneously. For epilepsy, sometimes it can take a little bit longer, sometimes a few weeks or a few months to see the maximal effects.
Are there controls? Or is there a way to make sure it's not stimulating too much?
Yeah, that's a really good question, and our knowledge and our experience has really advanced in the last couple of years. So we know a good starting point for most people, but we're working on this in my research lab and other research labs to figure out how do we dial in that stimulation to just the right settings for that individual patient.
Can the individual patient control that? Is there like a remote control here?
You know what, there actually is. So we do give our patients a sort of a range, sort of a volume switch, if you will,
Sure.
For the therapy. And we allow our patients and we help educate our patients of how they can make those small adjustments at home.
Interesting. So how common is this particular treatment right now?
So we use it really commonly when pills or medications don't control conditions like epilepsy or Parkinson's disease. For instance, in epilepsy, up to a third of patients, a third of those 80,000 folks in our state that have that condition, they could be a candidate for a treatment like deep brain stimulation.
So, but medication is still the first option?
Of course. We always want to do medication first. Surgery is a good option down the line, but we really only use that when medications stop working.
And as far as the advancements that we've seen here, what's next? I mean, what do you see on the horizon?
One of the most interesting things that's happened is the initial generation of this device, the therapy, when we turned it on, it was like a lantern. light went everywhere. The newest versions have directional therapy. That's like a flashlight. So we point that flashlight, that therapy, right to the location of the brain where that therapy needs to go. And that's something that's here and now. It's something that's getting better as our technology advances.
Interesting. Are there side effects to this?
We have to be careful. We've got to make sure it's the right patient for the right disease. It's the right target. We have that electrode in just the right place. And sometimes when we turn it on, we can have side effects, tingling, numbness. But then we have to direct or change that flashlight to a new area so we get the therapeutic response and not the side
You
effects.
say the right patient and the right condition. How do you know it's the right patient?
That's a good question. And it depends on what are the symptoms that that patient's having, how long have they been on medications, when did those medications stop working. We look at all those factors, what the patient wants to do, and we put those all together.
Does this weaken over time? The effects, the good things that are happening, do they weaken over time?
Historically, we did see that sometimes for tremor disorders, but what we learned over time is that typically when the effect weakens, that means that we need to shine that flashlight in a new location or maybe turn the volume up of that therapy to get that same level of therapeutic effect.
And I would imagine battery life, like everything else, battery life is improving all the time.
That's true. We used to have to change out these batteries every 3 to 5 years. Now you can recharge it just like you put your cell phone on one of those wireless charging stations. We can now put a wireless device over the chest and recharge the battery.
And real quickly, let's say you're an active person, yet you're suffering from these conditions.
Yeah.
Can you be active? Can you run? Can you exercise? Can you do stuff?
Yeah, really good question. So yeah, I've had many patients who are swimmers, skiers, hikers, all those sorts of things. It's compatible with the therapy. You got to be careful, just like always. Wear a helmet if you're doing those high impact activities.
All right, Dr. Jonathan Parker, Mayo Clinic, Arizona, deep brain stimulation. Thanks for joining us.
Thanks for having us.